Hi, and welcome to another edition of our Fireside Chat. It's great to have everybody joining us today. I am here with Claudia Beswick, as always, and also Sue LeClaire. Sue is our Children's Services Manager, and she's here to talk to us about CWELC, as we have been calling it in the office. Friendly as that is, it is the Canada-wide early learning program. You're going to find out more about what that is. That's just a bit of a teaser. Before we start into the topic at hand, it is a very special day, January 25th. It is Bell Let's Talk Day. Claudia, do you want to talk a little bit about Bell Let's Talk and sort of mental health issues and the PMFRC?
Sure. I just wanted to take the time to acknowledge that today is Bell Let's Talk Day. It's very important that we're able to continue to talk about the importance of mental health and the resources that are available to CAF members and families. Bell Let's Talk Day really gives us the opportunity to have healthy and meaningful conversations about mental health. And we hope that the discussions can get more people comfortable reaching out when they need the support if they need it. As an MFRC, we really take a family-centered approach in everything that we do and how we provide support to the families. There could be a lot of different factors that impact a family's health and well-being, whether you've just moved into the community, whether you're dealing with a deployment, if you're on imposed restriction, or for those of you call it IR, or if you're just struggling with some day-to-day challenges or potentially releasing from the CAF. We want you to know that there are a lot of really diverse programs being offered from the MFRC, which we feel are fundamental in supporting our families. So even though we do offer a variety of programs and services, we know that we can't provide every level of service that a family may be looking for, but we have really good collaboration with our community and our base partners. And Julie, as we often say,
no door is the wrong door.
Right. We have our family navigators, we have our family counselors, and they will help facilitate a warm handover to any additional external resources that you may get referred to. So don't hesitate to reach out and give us a call. We all face challenges in different ways, and good mental health isn't about being happy all the time. Learn to recognize when your bucket's full, be kind to yourself, and know that it's okay to ask for help. Sometimes putting a name to what you're feeling is important, and that helps you process them. I know Julie will ensure that our list of services and contact numbers can be listed in the comments below, but please don't hesitate to give us a call if you're not sure what to look for, or if there's anything that we can do to help you find the information. In the meantime, I encourage you to keep the conversation going, either by joining our conversation, leave a comment or an inspiring message for the others in the comment section below, or maybe taking your own action and start a conversation with your friends and your family. That would be great. And I hope you all have a wonderful day.
And if you want to reach out to us and you are hesitant about reaching out on a public forum, like commenting on a video, remember the direct message function is there as well. If you send a direct message to the Facebook page, we will make sure that you get to the correct page. So today we're talking about CWELC. It's a big topic. If questions come up after the conversation, please feel free to reach out. We know there's a lot of information coming through, and for some people, it's more important than others. But for a lot of families, childcare is a huge topic. We know in Petawawa, it is a big topic. It is a big concern for families. But before we start, I know I did a very bad job with the acronym earlier. So Claudia, I'm going to hand it to you. Can you tell us what CWELC is? I think a lot of people sort of think about it as $10 a day daycare, because that's sort of what was in the media earlier. It's not exactly what it is, but can you sort of give us an overview of what does the acronym stand for, and then what is it?
So I tell everybody I know enough to be dangerous, and Sue really is the expert on this new initiative. And the CWELC, as Sue likes to refer to it as, is the Canada-wide Early Learning Child Care. And it's an initiative that got started with the Government of Canada to make life more affordable for Canadians and to find affordable childcare. The intent is to ensure families have access to high quality and affordable childcare. It's a multi-year plan, so it's not all going to come into fruition this year, but our daycare fees reduced by 50% at the end of December of 2022, and will be further reduced to that $10 to $12, I believe by 2025 or 2026, Sue.
That's
Um,
correct, yeah.
Yep. So we're pleased to be one of the organizations that signed up for this initiative, and our board of directors really acknowledged right away that this would be hugely beneficial to the CAF community. It's been quite a process for Sue and her team and our finance department getting everything ready and in line to meet all the guidelines that this initiative requires of us as the licensed daycare. But I want to assure families that we remain committed to maintaining the high standards that PMFRC daycare programs are already known for, but it's just to reduce costs to the families.
Other than that sort of that cost reduction, how does this affect families, Sue?
So I think to just go off what Claudia said, you know, childcare all across Ontario is quite expensive. And this really allowed more options for all other families, right? It allows them to be able to choose what type of program they want their child to attend, and it's cost effective for them. So it allows them to have licensed qualified care that's flexible and inclusive and affordable for them. So they can choose to do center-based, private home, and they're not choosing in a month to pay whether they're going to pay their hydro bill or their childcare bill. So I think it's all around extremely beneficial for our families because they have that option now, and it's an affordable option for them.
How does it affect the kids? So if we're talking about like prices going down, does that sort of affect the kids? Does it affect the program? Does it mean we can accept fewer kids, that we have fewer teachers, that we're doing less things? How does this affect the program overall?
So overall, it really doesn't affect any programming or staffing related issues. It is just really regarding the families and having affordable child care. The program, the CWOG program, is also looking across Ontario to expand childcare spaces as well. The province knows that there's a need in all areas across the province, so that's a big initiative under CWOG to get that done too. So really nothing changes. We still fall under the Child Care Early Years Act. We still have all the same legislation, all the same ratio. We offer all the same amazing quality activities and programs. It's just really nothing changes for the children and the staff. It's just more affordable for our families.
I love looking at the pictures on Facebook, and if you follow us on Facebook, seeing what the kids are up to when the MPs come, the crafts that they're doing, all the activities they have. It's always sort of nice to see how much fun that they're having in those childcare centers, and our team does such an amazing job with all of the little people that are entrusted to our care. I've done a little bit of advanced reading before that, and I sort of realized that this is a program that is available to families if they have their children in licensed childcare. All of the PMFRC Child Care programs are licensed programs. Can you talk about sort of what, families have options to choose one or the other? What is the benefits of choosing a licensed child care center for a family?
Well, I think first of all, it's important for families to have all types of choices. Every family is different and needs different type of childcare that best meets the needs of their specific family. But the benefits of licensed care is really having that consistent quality care. It's center-based. The programs really don't close unless there's something the province tells us to, really. They're getting early childhood educators who are registered practitioners under the Ontario College of ECE. They have a code and ethics of standards to follow. We also have a variety of other staff with diverse background that bring, their special skill set to the children and families. So there's a wide variety of like the latest research, knowledge, theory development, all on child development. So they have that broad expertise from a team of educators. It also allows them the security of knowing there are health inspections, there are fire inspections, there's a license and renewal process where the Ministry of Education, follows with legislation and regulation and making sure we're meeting all the standard base requirements. And for our license programs, it's really important that parents are part of our program and they have a voice. They have input to what our programs look like. If they have concerns, ideas, suggestions, all of those are implemented because we're really family focused. And that's important because when the family feels that they're valued, so did the children. So it's really that type of community-based program. And I think that's one of the greatest benefits of licensed center-based care is we bring our community into our programs. Our children are out in our community, and we do have a very unique, diverse community here in Petawawa, and we really bring that into our programs so that, you know, we really try to instill that pride that we're a military community for military families, you know, supporting military children.
As a mom of two children, they're not little anymore, but I remember when I went to those years thinking about, you know, when I put my kid in care, if I'm living in a new community, you know, is it safe? Is it being checked? So knowing that those structures are in place, that all of those inspections that do happen, that you're, you know, the professional accreditation that each of the people have, that makes a massive difference in terms of just your own ability to go to work and focus on your job, knowing that your kids are safe and they're well looked after. So that does make a big difference. Thank you, Sue. Claudia, I remember when this first was announced, a lot of the media stories were about daycare centers deciding, do they opt in, do they not opt in? The PMFRC didn't have to go ahead and adopt this program. Why did the PMFRC, why did the board and the staff make the decision that this is something that we had wanted to do and to offer families?
I would say essentially the purpose and the intent of the CWELC really aligns with the PMFRC strategic priority. You know, we continue to advocate in the best interest of our military community and PMFRC clients, and part of this collaborating with other stakeholders to provide various opportunities. So enrolling into this initiative and offering the high quality, affordable childcare to families was really an important step, and one that the board agreed to 100%, right? There was no real debate. We knew we wanted to go in this direction. It was just a matter of how we could make it happen and meet all the timelines. So, you know, PMFRC's community-centered approach was also a factor. Improving accessibility to our programs and our services is really essential, and how we do that. And we know that childcare is one of the top barriers that military families are dealing with across the country. I believe Petawawa is either the third or fourth largest base, and we have a young family demographic and a lot of children that are requesting childcare. So with the high demand of childcare that we receive, we recognize the importance of the initiative and the positive impact that would have on the families. So the team has been really working hard to make this as seamless as possible for the families. And we really appreciate also the support that we got from the County of Renfrew to help us make this happen, because there was a lot of stuff that we had to do. There were a lot of questions to see how we could make this happen, especially coming out of the COVID protocols and everything else, right? So there was a lot happening, and you know, there's value in it, and the push for this initiative just really aligned with what the MFRC is all about, and how we can best support the CAF community.
So we have a lot of programs at the MFRC when it comes to childcare. Which of the programs are eligible or fall under that CWELC banner?
So we have opted in for all our child services programs. So Little Troopers South Daycare, Little Troopers North, Kitty College, our private home daycare program, our 3 before and after school programs at Valor, Our Lady of Sorrows, and St. Francis of Assisi. So our specialized care program, as well as our casual care program, have all opted in. I think the important thing to remember is CWELC is for children 0 to 6. So children 6 years of age and over do not qualify for the reduced rate. They are charged our base rate that was pre-CWELC. So it is focused on children 0 to 6 years of age.
I think that's an important thing to sort of keep track of, sort of what counts and what fits in and what doesn't. If a family is currently receiving a subsidy, how does this affect them? We have some families that do receive that child care subsidy from the county. Does this affect them in any way?
So it does. So they receive the same reduction based on their parent portion. So whatever parent portion they pay, they get the reduction of, so as of November 1st, they would have gotten the 25% reduction. As of December 31st, they would have got the 52% reduction on their parent portion that they pay.
Thank you. One of the things that we talk about a lot and we mention a lot is that we are always looking for private home daycare providers, people who want to offer childcare in their home. If someone is a private home daycare provider and they are right now operating as an unlicensed daycare center, are they still able to join our network? And if they do, how does that affect the clients that they already have?
So yes, so if an unlicensed home wants to register with our private home daycare, they would automatically fall under the CWELC system with their existing children. So it's a great opportunity for unlicensed home. There's lots of benefits for them and the families that they're serving. We are having an open house on January 31st at 6 p.m. at the Southside Community Center. For anyone interested, it's just an information session. You can join us and talk to Angie, our emergency family care coordinator and private home daycare supervisor, about the benefits of joining under an agency to provide licensed private.
And I think it's a good opportunity to have that discussion. As someone who is not involved in the childcare industry, I know that there's like tons of questions that if you would be asking that I wouldn't even think to ask. So it's a great opportunity to sort of have that discussion and really talk about your individual scenario and what's important to your family and is it a good fit to make that jump. I'm going to put the link to the event in the comments underneath. So if you want to attend, even if you're sort of thinking about it, if you hit interested, you will get that reminder so you don't miss it. And I'm also going to put a link to our PMFRC jobs page because it's another way for you people to find us if they want to talk about private home daycare. Last question. We know that for parents, waitlist is an issue. Whether it is you have a little one and you're coming off maternity leave, or you are being posted in from another community and you are coming in, when is the best time to get on your waitlist?
So I would highly recommend that you get placed on our wait list as soon as possible. So this is for all families. Even if you're hearing that a rumor that you could potentially be posted to Petawawa, give us a call and get put on our wait list immediately. It doesn't hurt to be on the wait list. We do check-ins to make sure families still want to remain on the wait list. We let them know where they are on the wait list. They can contact us anytime for information, but as soon as possible, get put on that wait list. So all it means is that when a spot is available and we call you and you found other care or you no longer require care, you turn down the space, but at least you have that option.
And if there is a baby on the way?
As soon as you know for that baby.
The baby does not have to
make
make
an
an appearance. Even so people can put their name down during the pregnancy, even if they don't know the baby's name or the baby's birthday, you can sort of still go on for that spot.
Yeah, and we reach out to them and when they know, they usually ask for the due date, and then we reach out to them for more specific information at a later time. So
sometimes when people get on the wait list and they get a number, that number can seem very, very discouraging. And it seems like you have a date of when you have to go back to work, and that number doesn't seem like you are ever going to get to the top of the list in time. Can you talk a little bit about how that list works and how fast does it move and when does it move? Maybe just a word of encouragement to anybody who's sort of thinking about that wait list and what does that mean to them?
So sure, wait lists are tricky to kind of understand. So we do have a significant wait list, but we try to always tell families that, even if you call and we tell you you're 195 on the list, that's your number, but you could move quicker than that for all sorts of reasons. So we always say that it takes at least 20 children to fill one space. We are a transient community. People get posted and forget to tell us. People, decide to stay home, work from home. Grandparents move to town. The families decided that maybe a nanny would better suit their family needs. So typically we do say that it's 20 children. We call 20 people on the wait list before we have one accept. So try not to panic when we tell you you're 195 on the wait list, and typically it's about 18 months. It's just kind of a generic, that's the time frame that we've best been able to narrow down, but it does not mean anything. The most movement on our wait list is posting season. And again, in September, when our preschool children go to school, our toddlers move up, we can accept more children. But it really depends on who's on the wait list. And a lot of people put their name on the wait list and then decide that they don't need care. And that's why we're really working hard on following up with that list and making sure that we're reaching out and contacting everybody on them to get those numbers reduced to people who actually require care as soon as possible.
Does the age of the child matter? So, I mean, like if you are trying to get childcare for a 12-month-old versus a 4-year-old?
So it does a little bit. So our BAS programs, our before and after school programs, don't have as long as a waiting list. Typically because they could have older siblings who could care for them, or parents have flexible work schedules. So it's really a little bit harder to get into our preschool program, so that 3 and 4-year-old, because the children seem to come in at the toddler age. They come in at that 18-month, 12-month, 18-month, then move up to preschool and then off to school. So we usually take children in before and after and toddler. Not to say that we haven't taken children in our preschool program, we certainly have, because again, people move, they get posted, they've decided to go another route with childcare, but typically it's a little more difficult for preschool children.
And I think one of the things that sort of fits back with our theme of no door is the wrong door. If you're not sure what kind of childcare you should be applying for, you can be on more than one waiting list. If you are not sure what's going to work for your family, you can call Sue and have that discussion, and she can make a recommendation. What are your hours? What kind of care do you need? She can make that recommendation. Is private home daycare better for you? Is center-based daycare ready for you? She can have those conversations with you and help you to make those decisions. If someone wants to be on the wait list, who do they call? How do they get a hold of that?
So Meghan Lewis takes care of our wait lists. So they can reach out to her, and for any of our programs, so for all 8 of our licensed programs, she handles the wait lists and does the tracking, and families can reach out to her at any time to either be placed on the wait list or see where they are. And again, it doesn't really matter who they contact within the agency, they will refer the family to the correct person to get that information.
Thank you, Sue. So those takeaways, I think, are the easy ones for parents. There's nothing to do. If you are already in our childcare program, we've looked after it on that side. You can join our childcare program, get on that wait list as soon as possible. That is so important. And most of all, call us if you have questions about it. If you're not sure what the program is for you, we're happy to do that. And I guess that last takeaway is, if you are thinking about opening a private home daycare and you want to talk about whether it makes sense for you to join the PMFRC network, come to that open house. If you are busy on the 31st, you have something else to do, I am sure that Sue or Angie would be more than happy to chat with you offline about that. Don't let that be the deterrent for you. Thank you very much for joining us. And remember, January 25th, it's Bell Let's Talk Day. So have those conversations, check in on your friends. Let's get rid of that stigma of going through. And if you do need help, make that call. We'll make sure that those numbers are below us in the comment section. Thank you both, ladies. I appreciate your time.